I was a physicist, research physicist for a while. A number of odd jobs, including bartending, truck driving, organic farming. I ended up going to medical school. After medical school, I moved to the mountains of Colorado, where I lived for 15 years, being a small town family doctor. And after that, I moved to Denver to practice integrative medicine. In 2000, The Baby Boomer's Guide to Living Forever was published. That was my first book. Then in 2004, with noted futurist and currently chief engineer at Google, Mr. Raymond Kurzweil, we wrote Fantastic Voyage, and in 2010, we wrote another book together called Transcend, both of which became bestsellers. A lot of doctors, like myself, really, we weren't trained in this in medical school, so making recommendations, it's not a prescription drug, so we don't prescribe it, but we would like to be able to tell patients, well, you have the indica variety, and it's good for pain relief and calming. We have the sativa variety, and it's good for people that are chronically fatigued, for helping them to wake up and things like that. There are THC dominant types, there are CBD dominant types. The CBD dominant types are very good, for instance, for children with epilepsy. So as physicians, there are numerous training courses that are available to help us to learn more about it so that we can make appropriate recommendations to our patients. Since it became recreationally available in Colorado, I've been shocked by the fact that somewhere in the neighborhood of 30 to 40% of patients have already tried some type of cannabis preparation to help treat with whatever condition they're seeing me for. So it's extremely widespread nowadays in Colorado. But since it became available recreationally, anybody can go in who's an adult and use it. And so people who have chronic stress take it, people with chronic pain take it, people with insomnia take it, seizure patients take it, a wide variety of patients take it. And they report back to me that it's helped them in many occasions. Some people it doesn't help, but a significant fraction of the people have considerably beneficial relief. And one of the things that I particularly like about it is with chronic pain patients, they often are able to get off of the drugs that seem to be associated with more severe side effects, like chronic opiates are a leading cause of death due to overdoses. Chronic non-steroidal anti-inflammatory drugs are a cause of gastrointestinal bleeding. If we can reduce the use of those drugs and replace them with a cannabis drug or a cannabis product that is far safer, then I feel that the patients can live a more healthful and safer life and treat their conditions more safely. I have actually looked at the literature about what's happened since cannabis has become available recreationally in Colorado, because there was a lot of concern there'd be more traffic accidents because people are driving under the influence of cannabis as well as under the influence of alcohol. There'd be more crime. But what the statistics actually show is there's been a decrease in violent crime, there's been a decrease in traffic accidents, there's been a decrease in traffic fatalities, which came as a shock to everyone, law enforcement personnel, physicians, everyone has been kind of shocked by that, with one exception, and that's forcible rapes, which have actually gone up. But all of the others have gone down. So in sum, cannabis didn't lead to the type of problems that we thought it would, and it actually led to improvements in many of the parameters that we measure, such as violent crime and traffic. In the course of my training, and even after my training, I worked at St. Anthony's and Denver General Hospital, and on Saturday nights they colloquially referred to the local knife and gun club because they would see a lot of violent trauma on those nights. In virtually every case, alcohol was involved. The number of times that cannabis was involved was much smaller, and if cannabis was involved, it was in combination with alcohol. Cannabis itself leading to violent acts, I actually can't remember one. I think that the health consequences associated with marijuana are actually fairly small, given the proviso that you keep it away from teenagers, keep it away from pregnant women. But for healthy adults, the health consequences are quite minimal. For most people, they can safely have 1 or 2 glasses of wine as well. But of the two, I think the addiction potential is far less. There is a slippery slope with alcohol, even with modest use, where a certain number of people, because of a genetic predisposition, will become addicted to alcohol. That virtually, or I should say it's virtually never, but it's far less. Perhaps a third or a fourth as common with cannabis than it is with alcohol. My advice to other doctors is to learn more about it, because there are thousands of articles now in the medical literature demonstrating the fact that cannabis can be safely used to treat conditions that really we haven't been able to treat before, like Dravet syndrome, a particularly severe form of epilepsy. Children with very bad epilepsy that are not able to be controlled with even 5 medications. We hear stories of parents moving to Colorado so they can have access to these high CBD strains of cannabis that don't get their children intoxicated, but are able to control their seizures. Kids that were having 80 and 100 seizures a day now have 1 or 2 seizures a month. So there are conditions that can be treated. Chemo-induced nausea. We do have very good drugs that treat that. Cannabis treats that as well. So chronic pain, there are topical formulations of cannabis. So if someone has bad arthritis in their fingers, why take a drug like a non-steroidal anti-inflammatory drug that has a capacity to cause a gastrointestinal bleed when you can just take a topical preparation and put it on your fingers and get some pain relief? So I think my advice to other physicians is attend a training course, learn more about it, see how to use it safely so that you can make the appropriate recommendations to your patients. In my experience, it's not a gateway drug to the use of stronger and more dangerous drugs. It's a gateway drug to better health.